Hello and welcome to today's mini lecture for Introduction to Substance Abuse, Psychology 1130. Today we are going to review the commonly abused substance known as ecstasy. There are three main types of ecstasy. The first and most commonly abused form is MDMA, which stands for methylene dioxymethamphetamine. We also have MDA, which is methylene dioxyamphetamine, and MDE, methylene dioxyethanoamphetamine. They're all known for their euphoric qualities as well as stimulating properties from the amphetamines. So their common effects that they all have in common are that they cause an increased heart rate, increased blood pressure, increased body temperature. They produce a sense of euphoria, energy, and alertness. They're also known to suppress appetite. A definition of ecstasy and why that street name was given to this substance is because it is known for creating an overwhelming feeling of great happiness or joyful excitement in a person. This drug was very popular in the United States during the 2000s, like the early 2000s. Due to the heavy regulation of this substance, it's not as commonly found as it was during that time period in the United States. However, it is still a popular party drug, rave drug in Europe, which is what it got its reputation for in the United States. So what people say of ecstasy is that when they ingest it and they're not experiencing the negative side effects, which there are negative side effects of ecstasy, what they feel is a warm sense of euphoria, a state of empathy, and loving feelings for all of those around them. When a person is experiencing an overdose of ecstasy, some of the common side effects include jitteriness, teeth clenching, and dehydration that can lead to death. So especially at high levels, when MDMA or another form of ecstasy is ingested at something like a rave, it's already a very hot environment. There is a lot of dancing going on. So when you combine the effects of the environment with the effects of the drug, a person could potentially experience an overdose and die. So the death would be as a result of stimulant overdose. So it would be the combination of increased body temperature, dehydration, hypertension, and kidney failure that cause death. MDMA should also not be taken with antidepressants, especially the MAOs, the monoamine oxidase inhibitors, due to the different contradictory effects of how they affect the serotonin in the brain. So MDMA, oftentimes people hear about ecstasy, Molly, and they think about it being created, in someone's basement lab somewhere. But MDMA was actually first synthesized in the laboratories of Merck. Merck is one of the world's largest pharmaceutical companies. This was in 1912, so MDMA has been around for over 100 years now. There was no documented clinical use until the 1950s, where the first clinical study was surprisingly conducted by the United States Army in 1953. So the Army, as well as psychotherapists later on in the 1970s, were researching the use of MDMA as a psychotherapeutic intervention to be used in conjunction with traditional psychotherapy treatment. One of the reasons that it was becoming a potentially therapeutic substance is because of its ability to produce a state of openness and empathy that would be conducive to healing in a psychotherapeutic setting. It was thought to help patients have life-changing insights and understandings. So it was never realized as a legal substance and is still illegal in the United States. If you would like to research more about how MDMA is currently being clinically researched as an effective treatment for PTSD, anxiety, and depression, you may view the MAPS link provided in Moodle. It is known for, again, creating that feeling of openness and empathy, and it's being studied as useful for trauma patients because of that fear of opening, because of how PTSD affects a person on a psychological and emotional level. Oftentimes, war veterans come home from their traumatic experiences and find it very challenging, if not impossible, to open up on a heartfelt, intimate level with their partners. So MDMA has been clinically researched by the military as well as by MAPS for use in treatment of severe cases of PTSD. These clinical trials are approved by the government and obviously only occur with the appropriate, educated medical and psychotherapeutic professionals. It has been found that it can be useful in short-term clinical settings. However, MDMA obviously can be an abused substance and obviously has dangerous effects, including death. There's a huge difference between the quality of MDMA that's being experimented with in clinical trials and the street substances that a person may be able to find on the street. Again, in the clinical trials, these medications, the MDMA, is being synthesized in multi-million, if not billion-dollar laboratory settings versus illegal combinations on the street where there's no guarantee that you're getting what you think you're getting, and you have no way of regulating or knowing what exactly is in that substance. So how does MDMA work? MDMA works by creating a surge of serotonin production in the brain. Unlike the SSRIs, the selective serotonin reuptake inhibitors, the MDMA creates this rush of serotonin, this rush of that feel-good, of the empathy, of the love, of the opening up of the heart, where there wasn't any serotonin before, which is again why it would be useful for a person suffering from chronic depression or PTSD or anxiety. Oftentimes chemically in people who have been diagnosed or experiencing those disorders, they don't have the high levels of serotonin. They're depressed. So even when they do activities that they might normally enjoy, their body isn't creating the serotonin in response to those activities like it would have if the depression, the anxiety, or the PTSD wasn't in the way. So the MDMA in a clinical, medical, regulated setting can create that serotonin rush as a catalyst for change in that person. The SSRIs, the selective serotonin reuptake inhibitors, the antidepressants, which again were formulated based on many of the MDMA studies that were occurring at Merck and other pharmaceutical companies in the early 1900s, before the big boom in prescription drugs for mental disorders. So the SSRIs, they don't create rushes of serotonin in the body. What they do is they prevent the serotonin from being sucked back up into the synapses, therefore, prolonging the feel-good that comes along with having the serotonin in the body. So when a person takes an SSRI, it functions by preventing the serotonin from being sucked back up into the synapses. However, it's not affecting the amount of serotonin that the person is producing or releasing. So if you have a person who is unable for one reason or another to produce the amount of serotonin that would really help them to feel better, the SSRI is only going to work so far, which again most antidepressants actually only have about a 50% efficacy rate. So one of the things that can happen when a person abuses MDMA is they can definitely feel sick the day after when they're coming down from the MDMA and there is now this lack of serotonin in their body. And a person becomes addicted to MDMA more because they're becoming addicted to the feel-good, to the high, to the serotonin rush, than they are to the substance in a dependency format like we would see with alcohol dependence or people who are dependent upon opiates. So behaviorally, the person who is abusing MDMA becomes addicted to the high, to the rush, to the rave, to the party scene, thinking that that is the avenue to a deeper level of fulfillment. And many people who have abused MDMA for long periods of time, not only do they find that they build a tolerance to the MDMA, which can be dangerous in and of itself, but they also find that years later, when they are not on the MDMA and they're not abusing the substance, there are cases of serotonin production inhibition or damage where a person is now producing serotonin at a lower level than they may have been producing it at had they not abused MDMA, because because they don't know at that time what the long-term effects of the MDMA are going to be on the serotonin production. It's almost like overusing that aspect of the brain's ability to produce the serotonin. So again, for people who are traumatized or chronically depressed, the clinical trials show that MDMA does work as a medicine that boosts serotonin and can serve as a catalyst for change and thinking in people. But again, it has addictive potential on the chemical level as well as on the behavioral level, and the side effects are severe as to reach death. In conjunction with the legal repercussions associated with possessing MDMA on the street, as it's still a Schedule I substance by the FDA. If you would like to learn more about how MDMA is being researched clinically for the treatment of PTSD, please review the MAPS link in the middle page. Thank you very much for your time. I hope you learned something new, and I look forward to teaching you again soon. Have a great day.